my name is Lauren. I'll be your student nurse today. I'm going to wash my hands, provide privacy. Can you tell me your name and date of birth, please?
Katrina 2/22/97.
Thank you. Can you tell me where we are?
UM
And what year is it?
2017.
So patient is ANO times 3. She appears the stated age. Her overall hygiene and grooming is well kept. There's no obvious signs of illness. Her mood and affect is calm and cooperative. Her speech, based on the questions I asked her, were clear and logical. Are you experiencing any pain?
Mm-hmm.
What about allergies?
Mm-hmm.
Okay. I'm going to inspect her head. So the color is normal for ethnicity. There are no lesions, and if there were, I would do A, B, C, D, E. I'm going to palpate her skull. There is no masses. Her hair is smooth, silky, evenly distributed. The temperature is warm to the touch. That's it for the hair. Next, I'm going to look at your eyes. So they are symmetrical and reactive to light. I'm going to have you follow my pen light. They accommodate, which means they are perla altogether. I'm going to look in your mouth. Her oral mucosa is pink and moist. Pull down your lip for me. There's no bleeding at the gums. The gums are also pink and moist. Her teeth are white. There's no cavities. There's no coating on her tongue. I'm going to have you say ah. The uvula rises midline. She does not have her tonsils in. So next, we're moving on to the face. The face is symmetrical. There's no drooping. I'm going to have you smile, raise your eyebrows, puff out your cheeks, and then frown for me. Okay, cranial nerve 7 is intact. I'm going to touch places on your face, and you tell me where you feel my touch. I'll close your eyes.
Left cheek, right cheek, forehead, chin.
Cranial nerve 5 is intact. Next, I'm going to palpate your carotid pulse, one at a time. They are +3, equal bilaterally. The rate and rhythm is regular. Next, I'm going to listen with the bell of my stethoscope. And have you turn your head and hold your breath. No bruise noted. I'm gonna inspect your arms. Color is normal for ethnicity. There is a mole, so it's symmetrical. There is no irregular border. The color is light brown. The diameter is about 2 millimeters, which is normal, and then it is not elevated. And then her temperature is warm to the touch. I'm going to check your radial pulse. I'm going to have you move your watch up a little. Her radial pulse is +2, equal bilaterally, rate and rhythm are regular. Her brachial pulse is +2, rate and rhythm regular, equal bilaterally. I'm going to have you put your fingers together like this. There is no clubbing present. And then I'm going to check for cap refill. All are less than 3 seconds, which is normal. I'm going to have you grasp my fingers. And her strength is 5 out of 5, which is good. I'm going to show you where the valves are at the heart. So the second intercostal space, right sternal border, is the aortic. The second intercostal space, left sternal border, is the pulmonic. The third intercostal space, left sternal border, is the Erb's point, and this is where you hear heart sounds the loudest. The fourth intercostal space, left sternal border, is the tricuspid. And then the fifth intercostal space, left midclavicular line, is the mitral. And this is where you would listen to the apical pulse for 60 seconds. Now I'm going to listen with the diaphragm of my stethoscope first. So this is where I would listen for 60 seconds, and then I'm going to change it to my bell, and then listen all the way back up. So I heard S1 better at the apex of the heart and S2 better at the base of the heart. I didn't hear any extra heart sounds, and there is no murmurs present. Next, I'm going to listen to her lungs. I'm going to do 8 in the front, 2 on the sides, and then 10 on the back. Deep breaths for me. And then 2 on the side. Okay, I'm going to have you swing your legs around. And then listen to 10 on the back. Lung sounds are clear. I didn't hear any adventitious sounds, so no rhonchi, anything like that. I'm going to have you bend over a little bit. Check her alignment of the spine. It is midline. There seems to be no scoliosis. Okay, I'm going to have you sit up. On the side, her AP diameter is 2 to 1. There is no barrel chest. And then I'm going to check her CVA tenderness. Tell me if you feel any pain.
No.
No CVA tenderness noted. I'm going to have you lay down for me. Pull up your shirt. Thank you. I'm going to inspect her skin. So the color is normal for ethnicity. There is no rashes, scars, drains, tubes. It is symmetrical on both sides. The umbilicus is midline. Next, I'm going to name where the organs are in each quadrant. So the right upper quadrant, you have your liver and your gallbladder. The left upper quadrant, you have your pancreas and your spleen. The left lower quadrant, you have your left ovary and your descending colon. And then your right lower quadrant, you have your appendix and your ascending colon. And then I'm going to look at the side. Her body contour is flat. Next, I'm going to listen for her vowel sounds with my diaphragm. Vowel sounds are normal active, and then I'm going to do light palpation. This is checking for any distension, enlarged organs, pulsations. So there is none noted, and then I'm going to have you get up on a 30-degree angle and then check her JVD. There is none noted. Okay, next I'm going to inspect your legs. I'm going to have you pull up your pants for me. The color is normal for ethnicity. There is no lesions. The temperature is warm to the touch. I'm going to check her dorsalis pedis pulse. It's 2+. equal bilaterally, rate and rhythm are regular. And then her dorsalis pedis pulse, 2+, rate and rhythm regular, equal bilaterally. Next, I'm going to check her malleus for any edema, and there is none present. I'm going to have you push up against my hands and then push back. So her strength is her leg strength is 5 out of 5, so that's good. I'm going to have you stand up, walk across the room, and then walk back. This is called her get up and go test. She could do it on her own. She didn't need any help. I'm going to have you stand, arms at sides, close your eyes. And this is assessing if she can stand on her own, so she's steady, there's no swaying. And then this is called the Romberg test. It's negative. And then her gait was steady, and she could walk independently, and that's it.